Good evening. Clap once if you can hear me. Clap twice if you can hear me. Clap 3 times if you can hear me. All right, good. This energy is great, thank you. Well, good evening, everybody. It is my pleasure to welcome you all to Catherine's Health Center's Open Doors Dinner. My name is Allie Shook, and I have the joy of serving as Catherine's Development Director. Thank you for joining us for, I believe this is our largest and our first ever evening event. So, yeah. So, just a quick show of hands. This is your first interaction with Catherine's. All right, good. There's a few of you. Well, I'm so happy that you're here, and I truly hope this isn't the last time that we see each other. So I'm going to give you a quick introduction and maybe a refresher of who we are. So Catherine's, we are a nonprofit, hence the fundraising event, a community health center that has had a presence in Grand Rapids for over 27 years. Now, I could throw a bunch of acronyms at you that hold some significance, but what it all comes down to is that we exist to serve the healthcare needs of the community, particularly those that have significant barriers to access, those that the system is just not designed for. Our comprehensive and integrative services encompass a range of primary medical, dental, and behavioral health care. We come alongside our patients with support services and referrals to fully address all of their social determinants of health, because we know it's hard to work on something like your mental health when you don't have stable housing. About 72% of our patients receive some form of public health insurance. About another 15% are uninsured, and nearly all are underinsured. And you may have heard that the last few years we've been growing, and we're not just growing for growing's sake. It's because there's been an increased need for these services, and Catherine's can fill it. And this isn't just some good enough healthcare. You may have seen in your programs there's a number of different colored badges. These are quality awards issued by the federal government. And in 2022, we received a gold medal, which is the highest level for our services. We are recognized as a health center quality leader, a designation that only 10% of health centers in the country receive. Now, I want to highlight this not just to brag a little bit on my colleagues, but because our patients deserve this level of care. It doesn't matter what a person looks like or sounds like, where they were born, who they love, how they worship or not, how much money they have or where they live. Anybody who walks through our open doors is going to receive the same level of compassionate, patient-centered, and high-quality care, which I hope that's why you all are here tonight, because you believe that quality health care shouldn't be reserved for those with a certain income or insurance carrier or from a certain zip code. You also want everyone to have access to health care because it is everybody's right. You're here tonight to come alongside Catherine's patients, seeking what we all seek: to be heard, to be cared for, and to be understood. Something we say a lot in the biz is we can't just treat the symptoms, we have to treat the systems. And addressing systems requires a hell of a lot of grit and good company. And that's what I see here tonight, the good company of so many people who care and know it can get better. So together, let's make it better. Tonight, you're gonna hear from leadership and partners. You're gonna be witness to an incredible story from one of our patients, Ross. And my wish is that you'll walk away this evening feeling energized, hopeful, and inspired. And yes, we're gonna ask you to support Catherine's with a financial gift. But this is not about charity. This is about equity and justice and treating those systems. I mentioned the percentage of patients who receive public insurance. And unlike private practices or other health systems, we cannot limit the number of Medicaid patients that we see, and we don't want to. And we lose nearly $100 on every Medicaid visit. So that's where you come in. When you support Catherine's, you're helping ensure that one more person isn't getting left behind by a broken system. When you give to Catherine's, What you're really giving is something we all intimately need, the most priceless gift of all, our health. We want you to give generously, not because you feel bad or sorry for others, but because you also believe that our patients are worth it. And of course, we wouldn't be here tonight without the partnership of so many. So I'd like to thank all of our sponsors whose generosity completely covered the cost of tonight's event. Yeah, right? So that means any gift made tonight will go directly toward our services. So let's give another round of applause for our specialty provider sponsors. And our Wellness Warrior sponsors. And our Prevention Champion sponsors. So thank you all again for publicly demonstrating your commitment to equitable access to health care. There are also many of you here in this room who deserve recognition, folks that without whom Catherine's just simply would not exist. So if you're able, I'd like to ask the following stakeholders to stand, and we'll hold our applause until the end. So any past or present Catherine's board members? Any past or present Catherine's staff? How about volunteers or patients? I want to thank you all for being the lifeblood of the Catherine's mission. Now, before we break for dinner and continue to enjoy each other's company, go back to the bar, Matt's gonna come back up here and play guitar, I asked my friend Foster to ground us in a moment of reflection with a poem. Foster's been commanding stages for years in Grand Rapids as a talented artist and activist, and he currently serves as the vibe manager and community liaison at the Diatribe. And I'm really thrilled that he's graciously agreed to share his talents with us this evening. So again, I'm so happy to be here with you all tonight. Thank you for joining us and for partnering with Catherine's. Now, let's make some noise for Foster.
Hello, everybody. I hope that everybody's doing well. So I'm Foster. I'm one of the founding members of the Diatribe. We are a local nonprofit. If you ever get a chance, make sure you just Google us, man. We are very Googleable. I'm happy to be here in front of all these beautiful faces. Some I recognize, some I don't. So please reach out to me afterwards and let's have a conversation. I'm gonna do two pieces for you tonight. One of them is it's called I Wish, and it's about housing, and a lot of people need housing. A lot of people need fair housing. A lot of people need access to housing. And then the other one is specifically for this room. But this is what I think about. I wish I would have learned about fair housing when I was a teenager. Learned then that not every boarded up house was a drugged in, but maybe a missed payment. What if I learned the difference between renting and building equity and owning before I left my parents' house? What if I learned that the reason some folks kept renting was because they kept getting denied a home loan? I wonder how I would look at eviction and foreclosures when I learned about almost impossible to maintain lending practices. How even rock bottom interest rates and loose lending standards could turn into tight nooses. See, what if I knew back then that sometimes the landlord and Fannie Mae were the ones that fought for the unkept yard and not the tenant? Maybe now I wouldn't think that the grass is greener when you own the land and home that it's on. See, I wish I could have told my friends that schools aren't getting the same funding because of property taxes and that they'd listen and tell their parents. I for sure wish I would have taken accounting instead of geometry, because I haven't seen anybody use the Pythagorean theorem except for two teachers, one professor, Jeopardy, and this poem. But telling a kid or a teenager that most wealth in America begins with ownership of a home might have led me down a different path. Not to mention taxes keep taxing us, and this American pie ain't never added up to equal parts. See, I wish I didn't remember the first time that I heard that someone grew up on the wrong side of the tracks. When I recognized that there is a difference between poor and poverty, that where you live affects everything you do. Had I saw back then the Kerner Commission report or other speeches by King, I would have saw oppression in real time, realized that it wasn't history just happening 30, 40, 50 years after his death, still happening as I take each breath. Discrimination, whether it's intentional or not, is still discrimination. So I wish I would have saw a monopoly for the educational game that it is, that getting priced out ain't nothing but gentrification. I should have saw how gentrification rips open the community's chest, only waits for the chance to put you out. I should have comprehended that the bank could never go broke was the precursor for too big to fail. I wish I would have saw it being as rigged from the beginning. I should have known something was up when families still don't talk to this day because of it. See, I wish I would have saw all the red lines used to keep people out of the new deals, not from the wrong side of the tracks, but on the wrong side of the information. I wish that folks would realize I ain't wishing to go back in the past. I'm just wishing that today changes someone's tomorrow. If they only knew what I know now, maybe their future and the opportunities they could have would be bigger and better than I could ever wish for them. Thank you. We teach about writing to right wrongs. That's one of our programs. And there's been a lot of wrong that has been done in like the medical community. And it definitely needs to change. And I'm so happy to be in this room right here with all of you change makers that I wrote this one specifically for you. Here in the United States of America, the average checking account has less than $5,000 in it. Here, the average hospital bill is usually multiple pages stapled together, literature jam-packed on the front and back with coded messaging that average people don't, can't, and won't understand. Here in Michigan, the average ER visit is around $1,300, and the average hospital cost per day is almost $2,900. Here, folks are a hospital bill away from treatment, a hospital bill away from eating, a hospital bill away from paying rent or mortgages this month, a hospital bill away from poverty, a hospital bill away from an act of terrorism. Here, the average medical school degree is almost $230,000. Nursing school is between $25,000 and $100,000. Here, it costs years and time of training to practice how to heal. But here are folks that are a degree away from change, a degree away from making a kid want to be just like them, a degree away from helping someone not go through what their family member did. Here, the average person gets about 8 sick days per year and 0 for preventative care. In America, medical debt is one of the leading reasons for bankruptcies. But here, folks are more than numbers and dollar signs. Here today, there is a room filled with doctors, bankers, nurses, real estate. Name an industry. Here, there is a doctor who doesn't like the way things currently are. There's a nurse who's trying to change the way we care for our sick. There is someone that advocated. Here, there is someone who stood by the side of someone fighting a losing battle. Here, there is someone that made a baby comfortable enough to smile. Here, there is someone who will give a child the first glimpse of a stethoscope. Here, there is a person that will teach a kid a healthy lifestyle. Everywhere there are problems, but there are more resources than problems because I can see it in this room. In this room, there is hope. There are folks living and working towards their mission statements. Here, there is you. And all I want to do is say thank you.